Welcome back to my channel. If you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the appendix. The appendix is formally referred to as the vermiform appendix, and this is named after a Latin word vermiform, which means worm-shaped. So it is a worm-shaped structure that is seen to emerge on the wall of the cecum. So we can say that the appendix is a narrow finger-like or blind-handed structure that is seen as an emergence on the wall of the cecum. This is the cecum here, harrowed in black. The cecum is the first region of the large intestine. This is the large intestine here in this image, highlighted in green, and this is the cecum. So on the wall of the cecum is where we have the emergence of the appendix, and this is the appendix. The length of the appendix is about 9 centimeters. So let's look at the specific location of the appendix. We said that the appendix is an emergence on the wall of the cecum, but what region specifically on the wall of the cecum does the appendix emerge from? So the appendix emerges from the posteromedial wall of the cecum. This is the cecum here, as we've initially described, the initial segment of the large intestine. So if you go to the posteromedial wall of the cecum is where we have the emergence of the appendix, and this is the appendix here highlighted in black. So you see it emerging at the medial border of the cecum, but of course posteriorly. The appendix is seen to emerge 2 centimeters below the opening of the ileum. This is the ileum highlighted here in yellow. The ileum is the terminal region of the small intestine, and we know that the small intestine also is connected to the large intestine, and the region of the large intestine where it connects to is the first region of the large intestine, which is the cecum. So this is where we have the opening of the ileum, which is the terminal part of the small intestine. So if you try to take the distance between the opening of the ileum and also the emergence of the appendix is about 2 centimeters. So this is the region that is demarcated in red. So the distance between the opening of the ileum and also the emergence of the appendix is about 2 centimeters. Also to add that the appendix is referred to abdominal tonsil, which are of immune function. So why is the appendix referred to as the abdominal tonsil? If you take an histological presentation of the appendix, this is the kind of configuration that we would see. So using this image down here, we have the internal lining, which is the mucosal lining of the appendix. And this is the region here that is demarcated in red. Within the internal lining, which is the mucosal layer of the appendix, we have the lamina propria. The lamina propria is a sub-region of the mucosal lining of the appendix. And this region is seen to contain collection of lymphoid follicles. And this is what is seen in this image. If you drive in into this image, you see aggregation or collections of lymph follicles, and these are of immune function. And this is why it is established that the appendix is an abdominal tonsil. Now let's look at the sub-regions of the appendix. The appendix is further subdivided into 3 sub-regions. We have the tip, and this is the tip of the appendix. We have the body. This is the body, which is the central part. Then the last sub-region is the base, and this is the base. The base is the region of the appendix onto which it is attached or connected to the posteromedial wall of the cecum. So these are the 3 sub-regions of the appendix. So let's dive into take each of these sub-regions one after the other to see what they present. So going to the tip and the tip and the body present variable positions. So the positions of the tip and the body is not the same in all individuals. We already said that this is the base. The base is the point where the appendix is fixed onto the wall of the cecum. The base of the appendix is fixed. Regions following the base of the appendix, which include the body and also the tip. This is the body and this is the tip. These 2 regions are not fixed like the base of the appendix. They can assume different positions around the cecum. This will take us to the next slide, where we would establish the different positions that the body and the tip of the appendix can assume depending on individuals. So this slide will explain the different positions that the body and the tip of the appendix can take around the cecum. So the first one is the retrocecal appendix. So you see the appendix located posterior to the cecum, and this is the retrocecal appendix. You see it located behind the cecum. In this kind of position of the appendix is seen to be located within the retrocecal recess. Remember the retrocecal recess that we talked about in our previous lecture on the cecum, where we said that it is a space that is created at the posterior part of the cecum. This is where the retrocecal appendix is usually located. So it is seen behind the cecum, located in the retrocecal recess of the cecum. And it is the most common position of the appendix. It is seen in about 60 to 70% of individuals. And if you try to relate this position to the clock, it is at the 12 o'clock position. Going to the next position that the appendix can assume is the second most common position, which is the pelvic appendix. The pelvic appendix, just from the name, you should know that it is directed towards the pelvis. So you see this kind of position where the appendix tend to tilt or be directed towards the pelvis. This is the second most common position of the appendix, and you see it in about 20 to 30% of individuals. So this is the pelvic appendix here highlighted in yellow. So the next type of position of the appendix is the promontory appendix. This is where the appendix is directed towards the sacral promontory. The sacral promontory is the bulge that is seen at the upper part of the sacral bone, and you see this in about 2% of individuals, and this is the promontory position of the appendix. And if you try to relate this position to the clock, it is directed at the 3 o'clock position. If you look at this configuration, you see that this is directed towards the 3 o'clock position. Then the next type of position of the appendix is the subcecal appendix. Just from the name, sub means below. So subcecal appendix is when the appendix is located below the cecum. So you see it directed here, and this is what is highlighted in blue here. It is located below the cecum. It is seen within the right iliac fossa. We know that the cecum is located within the right iliac fossa, so also the subcecal appendix. And you see it is directed towards the inguinal ligament. And if you try to establish the direction of the subcecal appendix with the clock, you see that the subcecal appendix is directed at the 6 o'clock position, and you see it in about 2% of individuals. Then the next type of position of the appendix is the splenic appendix. The splenic appendix, just from the name, is directed towards the spleen, and this can take two formats. It can be pre-ileal appendix. Pre-ileal appendix, just from the name also, it means it's located in front of the ileum. We already said that the ileum is the terminal region of the small intestine, and this is what is highlighted here. It is located in front of the ileum. The second type of splenic appendix is the post-ileal appendix, and this is the post-ileal appendix. The post-ileal appendix, of course, from the name, it is located behind the ileum, and this is what is also presented here in green. So let's look at the next position that appendix can also take around the cecum. And this is the paracolic appendix or paracecal appendix. And this is located at the lateral border of the cecum. This is where it is highlighted here in purple. And this is seen at the 11 o'clock position. It is also seen in about 2% of individuals. So we can see the different positions that the body and also the tip of the appendix can take when we know that the base is fixed. So from the base, you see that it is located at one point, which is the posteromedial wall of the cecum, as shown here in this image. Then after the emergence from the base, we have the body and the tip, which can assume different positions around the cecum. And this is what we've established with this slide. Then going further to the last sub-region, which is the base. The base, we said it is the region that is fixed or attached to the posteromedial wall of the cecum. And we said that this region is fixed, it is not mobile and cannot take different position around the cecum as it is being presented in the body and also the tip. So this is the appendix here, located at the posteromedial wall of the cecum. So in trying to justify why the base of the appendix is located at the posteromedial wall of the cecum, during the developmental process, the appendix is located in the inferior part of the cecum, just as what is presented here. But it is the developmental process that is responsible for the base of the appendix to be positioned on the posteromedial wall of the cecum. Because of the uneven growth that is seen during the developmental process around the cecum, also the elongation and movement or rotation of the gut during the developmental process are responsible for the movement of the appendix, initially seen at the tip of the cecum before it is then repositioned to the posteromedial wall of the cecum. And that is how it moves, and of course being directed to the posteromedial wall of the cecum. The appendix at its base, that is the point where it is attached or fixed to the posteromedial wall of the cecum. It is being guided by a valve that is called the valve of Gerlach. This valve is not a true structural valve, but you see it at this point where we have the emergence of the appendix. This valve of Gerlach is seen as irregular folds of mucosal membrane lining the interior wall of the appendix. So it does not have a structural configuration of a valve, so it is used to guide the appendix at this region. And also to add that we have the convergence of the tinea cola at the base of the appendix. So at the base of the appendix is where we have the convergence of the tinea cola. The tinea cola is a longitudinal tissue that is seen to line the wall of the large intestine. It's also seen to line the wall of the cecum, and that is what is responsible for the infolding seen in the wall of the large intestine. This tinea cola is seen to converge at the base of the appendix, and that is another structural presentation that is seen here, and that is why you see thickening at the base of the appendix in gross presentation. So the base of the appendix is usually thickened because of the convergence of the tinea cola. Then about the McBurney's point. The McBurney's point can be used to establish the surface marking of the base of the appendix, and this is good for clinical practitioners. So let's use this image down here to explain the McBurney's point. Let's say we have the umbilicus. This is the umbilicus at the central part of the abdomen. If an imaginary line is drawn from the umbilicus down to the anterior superior iliac spine, this is the anterior superior iliac spine, and this is the anterior inferior iliac spine. We have tried to establish this in our previous lecture on the bone in pelvics. If you've not also checked that lecture, please kindly go and do so as to keep yourself updated. So this green line running from the umbilicus down to the anterior superior iliac spine is called the spino-umbilical line. This spino-umbilical line, if you then further try to subdivide it into 3 equal sub-regions, you see it being demarcated by these lines. So if you look at the junction between the medial 2/3 and the lateral 1/3, this is the junction of the medial 2/3 and the lateral 1/3. So at this junction is where we have the base of the appendix placed in surface marking. So if you can do surface marking of the spino-umbilical line, at this point where we have the McBurney's point, which is the junction between the medial 2/3 and the lateral 1/3 of the spino-umbilical line, is where we have the McBurney's point. And the McBurney's point is used as to establish the surface marking of the base of the appendix. So let's try and highlight the functions of the appendix. The appendix is known to be a vestigial organ, but as time goes on, different functions or properties have been attributed to the appendix, and one of which is immune responses. We have already established in our previous slide that in the histological presentation of the appendix, we have lymphoid follicles expressed in the microscopic view within the lamina proper of the appendix. And these lymphoid follicles are known for immune function. Then the second function is that they create accommodation site for beneficial bacteria. If you go through my lecture on the large intestine, you see where it is established that in the large intestine, we do not have digestive enzymes. What we have in the large intestine are useful bacteria, which are also responsible for breaking down undigested food. So within the wall of the large intestine, we have useful bacteria, but specifically within the appendix, this bacteria can be accommodated in this region. So it tends to create like an accommodation site for these useful bacteria so that they can repopulate following gastrointestinal illness, such as dysentery and also cholera. So they can create like a site where they can be housed or caged, and when needed, they can be repopulated to move into the other regions of the large intestine where they can help to break down food substances. So let's go to mesoappendix. Mesoappendix simply means mesentery of the appendix. We know that mesenteries are formed as a result of intraperitoneal presentation of organs. And you see the mesentery of the appendix as a short triangular mesocolon. That is the short triangular mesentery of the colon. So this is what is presented here in this image, a short triangular mesentery of the appendix that is formed. And you see it connecting the appendix to the terminal region of the ileum. So this is what is presented here. And if you go back to our previous lecture where we tried to establish intra and retroperitoneal organs, we see that for intraperitoneal organs, we see the entire surface of this organ lined by peritoneum. And if the entire surface is seen to be lined by peritoneum at both ends, the peritoneal membrane we connect, and this is where we have the emergence of mesentery, and this is where we have mesentery. So it is this mesentery, after enclosing the entire surface of the appendix, you see it now running at this end. This mesentery then connects the appendix to the terminal ileum. So that is how we have the formation of the mesoappendix. For the appendix, it is different. It is not connecting the appendix to the posterior abdominal wall. You see it connecting the appendix to the terminal region of the ileum. And that is what is highlighted here and arrowed in red. And what this mesentery does is to help accommodate vessels, which include blood vessels, lymph, and also lymphatics. So if you try to cut through this mesentery, you see that within it, you have blood vessels, nerves, and also lymphatics that is going to be supplying the appendix. So let's go to the blood supply of the appendix. The appendix is supplied by the appendicular artery. The appendicular artery is a branch of the ileocecal artery. The ileocecal artery branches from the superior mesenteric artery, and the superior mesenteric artery is a branch of the abdominal aorta. So let's see how this goes. So this is the abdominal aorta. This is the pipe here. So this is the abdominal aorta here, arrowed in black. So from the abdominal aorta, we have the emergence of the superior mesenteric artery, and this is arrowed in yellow. From the superior mesenteric artery, we have the emergence of the ileocecal artery, which is arrowed in green. From the ileocecal artery, we then have the emergence of the appendicular artery. So this is the appendicular artery. This appendicular artery then goes straight to supply the appendix. You see it running behind the ileum. This is the ileum. You see it running posterior to it before it's now been able to access the mesentery. Remember, we talked about the mesentery in our previous slide, connecting the appendix to the terminal region of the ileum, which is specifically referred to as the mesoappendix, which means the mesentery of the appendix. The mesentery is seen around this space, and you see the appendicular artery running in between the mesentery. So the mesentery of the appendix will be creating like an accommodation site for the appendicular artery in trying to protect or guide it in a way. The appendicular artery is known as an end artery. It is an end artery because it does not form anastomosis with other vessels as what is presented in other regions of the large intestine. So you see it just emerging from the ileocecal artery and going to terminate on the wall of the appendix where it supplies it with oxygen and nutrients. And that is why the appendix is prone to ischemia when it is infected or during inflammation. Also note that there can be emergence of the accessory appendicular artery. Accessory means support. So accessory appendicular artery can emerge from the posterior cecal artery. The posterior cecal artery is a branch from the ileocecal artery, of course, which branches from the superior mesenteric artery. We know that the superior mesenteric artery gives branch to the ileocecal artery. The target of the ileocecal artery is to supply the cecum and also give off the appendicular artery to supply the appendix. The ileocecal artery branches to form the anterior and the posterior cecal artery to supply the cecum. So from the posterior cecal artery, we can have the emergence of an accessory appendicular artery that also supplies the appendix. So it's also good for us to establish this. So talking about the lymphatics, the lymphatic drainage of the appendix is the same as that of the cecum. The appendix is drained into the ileocecal lymph nodes, which finally drains into the superior mesenteric lymph nodes. For the innervation, we have sympathetic and parasympathetic innervation. The sympathetic innervation is supplied through T9 and T10 spinal segments. So it is also good for us to establish the fact that referred pain from the appendix can be felt around the paraumbilical region. This is because the paraumbilical region of the abdomen is also innervated by T9, T10 spinal segments. So when you have pain in the appendix, it will also be relayed to this region because they are supplied or innervated by the same spinal segment. It's also good for us to be able to establish this. Why the parasympathetic innervation is through the vagus nerve. So let's go to clinical anatomy. The clinical anatomy I want to highlight is appendicitis. Appendicitis is a condition that is characterized by acute inflammation, and this can occur as a result of infection or blockage of the wall of the appendix. And when this happens, it comes with pains. The pains is generally rooted from the paraumbilical region before it diffuses to the right lower quadrant. And this we have established in our previous slide, where we have the referred pain from appendicitis in the paraumbilical region, because the spinal segment that innervates this region is the same as the appendix. And major symptoms would include nausea, vomiting. There could be poor appetite and also fever. And major treatment is removal, and the removal is done by appendectomy or appendicectomy. We can check our understanding of this lecture through the following question. And the first one is to explain the sub-regions of the appendix. The second question is to describe the different positions of the appendix. We've described this in our previous slide, that the body and the tip of the appendix can assume different positions. Then the third question is to explain the blood supply of the appendix and its characteristics. The last question is, what is appendicitis? So thanks for watching. Let's meet again.